Hello everyone, and welcome back to my channel. My name is Dr. Stephen Roth, and I'm a board-certified oral and maxillofacial pathologist. Today, we will delve into the fascinating world of artificial intelligence, or AI, and its groundbreaking applications in the field of oral pathology. In this video, we will explore how AI is transforming the way we diagnose and treat various oral diseases and conditions. From advanced image analysis to predictive modeling, join us as we unravel the potential of AI to enhance accuracy, speed, and efficiency in oral pathology, ultimately leading to improved patient outcomes. Let's embark on this captivating journey at the intersection of dentistry and cutting-edge technology. Okay, I gotta come clean. That introduction was written for me by OpenAI's ChatGPT. I know every other YouTuber has done this for their AI videos, but I couldn't resist jumping in on the trend even if I am a month or two late. AI is the next big advancement in technology, and I expect that it will revolutionize every facet of our life, including how we deliver our healthcare. Before we jump into AI's potential impacts, we have to run through that disclaimer, which is that all opinions expressed in this video are mine and mine alone, and do not represent any organization that may employ me or that I may belong to, and that this video is for educational purposes only and should not serve as medical advice. Should you have any questions or concerns about your oral or systemic health, please see your nearest oral or systemic healthcare provider. Oral pathology has two facets: direct patient care and microscopic diagnosis. We still don't know how these advancements in AI will affect either aspect of our practice, but there are already resources and research on using AI as a tool in pathology. First, let's discuss patient care, as I think AI is potentially limited in this area. Oral pathologic findings are subtle and often require not only visual inspection, but also palpation. We already have many, quote, diagnostic aids, but research has shown time and time again that none of these aids have outperformed a visual clinical exam using just the eyes. Because of this, I think AI's reach will be limited. There is one resource that may change the game in delivering patient care, as well as in healthcare in general, and that is a resource called Open Evidence. Open Evidence, like ChatGPT, is a tool that utilizes artificial intelligence to perform a variety of tasks. Unlike other AI tools that I've seen, Open Evidence uses and cites actual academic papers as sources in its output. Not only that, but it is constantly learning from and analyzing new papers as they're published. This constant learning will allow clinicians to access succinct summaries of conditions and treatments that align with the latest peer-reviewed evidence. Here's an example of how we can use this resource. Let's ask Open Evidence about how we can treat oral lichen planus. Within seconds, not only do we get a summary of the disease, but also several treatment modality options. Each point made includes a cited reference which can be accessed directly to confirm the accuracy of the information we're being given. This is only one example of how we can utilize this tool to deliver better patient care. I'm sure that there are many clinical questions that can be answered using Open Evidence's AI. Microscopy and histologic diagnosis is where I see there being a ton of AI and machine learning application. And there has already been a lot of study on how to use machine learning in pathology. First, we need to start with the basics. The practice of pathology revolves around examination of tissue microscopically. Classically, this is done by examining sections of tissue that are placed on a glass slide and examined under a light microscope. In fact, I made a whole video discussing how glass slides are made. I've linked to this video in the description, and it'll also appear on the end card after this video. More and more, the profession is moving towards digital microscopy. A glass slide is scanned and a computer file is made. Certain software allows the pathologist to navigate and examine these scanned slides on their computer rather than using a traditional microscope like this one. Once scanned, the tissue image becomes data. This data can be analyzed through AI machine learning, and as Open Evidence tells us, these images have been used for tumor region identification, metastasis detection, and patient prognosis studies. Someone much smarter than I could probably give a multiple hour-long seminar on how AI is already being used in pathology, and the opportunities and possible use cases are infinite. But I do want to share one specific example so you can get an idea of how this works. A study from 2022 published in Frontiers in Oncology looked at a very important aspect of oral cancer, and that is perineural invasion. This is when cancer starts to wrap around the nerve and is a sign of more advanced or aggressive cancer. The first thing that these authors had to do was teach their AI how to perform its task. It's called machine learning because the machine must be taught the patterns that it's going to be tasked with recognizing. The authors used a computer system to label both normal nerve and nerve that had tumor wrapped around it. They did this 389 times to show the computer the pattern that it needed to recognize. After the software was taught the pattern to recognize, it was put to the test. It was given 151 images to review. The AI was over 91% accurate in correctly identifying perineural invasion. Not only that, but the computer was much faster at identifying the perineural invasion than the pathologists in the study. This is only one example of one application of how these new tools can help improve the care of our patients. It is truly an exciting time, not only in healthcare, but in virtually every industry. I don't see AI as a threat, but rather a tool that can help make our lives more efficient. In healthcare, I see AI providing faster, more accurate data, which will ultimately improve patient outcomes. I think there will always be a role for human being oral pathologists, though what we do may change slightly. I really hope that I don't look back and regret these words in 10 years. Oh well, time will tell. Thanks again for watching. I hope you found this topic as fascinating as I do. And if you like this video, be sure to give this video a like and please share it with someone else who may like it as well. If you haven't already subscribed, please be sure to hit that subscribe button. Thanks again for watching and be well.